The learning objectives for our laboratory study of the urinary system are listed on page 77 of your lab manual. And this video will introduce you to these structures, first with models, and then with both human and non-human specimens. To begin, let's look at the big picture, an overview of the kidneys in place. They're bilateral to the great vessels, the abdominal aorta, and the inferior vena cava. They receive blood by way of the renal artery and return blood by way of the renal vein. In this view, we see also, and incidentally, an unrelated structure, which is an endocrine gland, probably known to you as the adrenal gland or suprarenal gland. A human kidney might be 4 inches in overall length on the vertical axis, and on this side it's been cut away, and we'll use a different model now to investigate the interior. Before we begin our examination of actual kidney specimens, let's begin with an oversized model of a human kidney. This is easily 4 times larger than the size of a human kidney, but we can certainly see structures here that might be difficult later in a real kidney. So refer, please, to page 77 of your lab manual with attention to figure 63. We're going to consider now the gross anatomy of the kidney, the things that we can see with our eyes. Actually, the kidney is kind of a C-shaped organ, a crescent, and the surface, which in a human kidney may be about 1/4 of an inch deep, is called the cortex, a word meaning bark, B-A-R-K. And so here is the renal cortex. Everything deep to the cortex is the medulla, a word which means core, C-O-R-E. Now the core, or renal medulla, is organized and segmented into distinct lobes which have a kind of pyramidal appearance when seen in 3 dimensions. Accordingly, these structures are called renal pyramids. And these dip down into the interior of the medulla, and each one tapers into a kind of nozzle or nipple. And that's referred to as the renal papilla. The papilla is where urine congregates and drips constantly into these cup-like receiving areas referred to as calyces. In fact, the word calyx means cup, C-U-P. The first to receive urine are smaller and therefore referred to as minor calyces. Here's one seen from above, looking a bit like a funnel. 2 or more minor calyces will empty you into a larger space, which is then called a major calyx. 2 or more major calyces form this very voluminous space deep in the medulla, and that's referred to as the renal pelvis. That's marked as number 10 in the figure you might be looking at. The renal pelvis tapers into a singular tube which exits the kidney proper and tapers in to the ureter. The ureter travels retroperitoneally and eventually, of course, delivers the urine to the urinary bladder. In the figure you're looking at, the ureter then number 11, the urinary bladder number 12. Now let's consider the blood supply to and from the kidney. Of course, you know the artery that enters the kidney is called the renal artery. And once it enters the interior, it splits into many smaller arteries which travel between the pyramidal segments. Because we can think of these as lobes, this vessel, these vessels, are called interlobar. And they unite or come together to form a kind of arc which is seen here and actually helps to define the cortex from the medulla. This vessel, shaped a bit like an arch or arc, is called the arcuate artery. And it throws off many smaller arteries which extend to the surface. These are called interlobular arteries. Now the arterial network is matched and runs parallel to the venous network. So these would be interlobular veins. This would be the arcuate vein. And arcuate veins empty into interlobar veins, which eventually unite and merge and empty into the outgoing renal vein seen here. So that's a quick tour of what we can see on an enlarged model such as this. This is another kidney model of similar size and scale. And it shows nicely, again, these parallel vessels that travel between the pyramids. So these would be the interlobar artery and vein. And spanning across and helping to define the cortex from the medulla would be the arcuate artery, arcuate vein. What this model attempts to do is show nicely at least the position of the microscopic structures that you've learned are called nephrons. A nephron begins with a ball-like structure which is really a tuft of capillaries surrounded by an epithelial bowl. Those capillaries, known as the glomerular capillaries, and the bowl itself referred to as Bowman's capsule or the glomerular capsules. Now in lab, our attention is mainly to the gross anatomy, and so the glomeruli are difficult to see except with special preparations. But at least here, the glomeruli are enlarged and exaggerated somewhat, showing, for instance, the loop of Henle, and particularly nicely, the collecting ducts. And the collecting ducts merge and come to a tip, which we've already identified as the renal papilla. And this drains urine constantly into this cup, the first of which is called a minor calyx. And the merger of two or more minor calyces forms a major calyx. And those, all of the major calyces, converge into the renal pelvis, which carries urine out into the ureter. Remember, our work in the lab is limited to gross anatomy, but lecture content certainly dwells on the microanatomy as well. So in this enlarged segment of a kidney, we can see and highlight the renal cortex, the renal medulla, the nipple-like renal papilla, and here, quite enlarged, the glomeruli, of which there are 1 million at least in each kidney, and the blood supply to the glomeruli, which are arterioles coming in, afferent arteriole, exiting efferent arteriole. The nephron itself, aside from the glomerular capillaries, begins with Bowman's capsule, also called the glomerular capsule. And this exits as a twisted tube, seen here for instance, the proximal convoluted tubule, which then tapers into a hairpin loop which extends deep into the medulla and forms much of the renal pyramid itself. This is called the loop of Henle, or simply the loop. The loop returns to the cortex, where it forms a twisted tube, the distal convoluted tubule, and many of these empty into a singular duct which terminates at the tip of the renal papilla. That duct is called the collecting duct. In this view also, we can see the arcuate vessels and the vessels which enter and leave the arcuates, namely the interlobar artery and vein. The model also attempts to show a network of capillaries which surround the loops. Those capillaries, very important to absorb water and other materials. Those capillaries referred to as the peritubular capillaries. Now let's move to an actual specimen, a pig kidney. And you can see its size is quite large. This is the surface view. And we've made a mid-frontal section. The interior resembles that of a human kidney in all respects. Even at this magnification, we can see a distinction between the surface cortex and the deeper interior space, which is the medulla. We can also get the impression of lobes, which are in fact more commonly referred to as pyramids. Zooming in, we can see an area of urine collection at this location, this being a renal papilla, and this space here a minor calyx. Another one here. On the other half, we see the same structure repeated. So, at this magnification, the renal cortex, all of the medulla, a renal pyramid, a minor calyx here, which would feed into a larger space, a major calyx. The blood supply to this pig kidney has been injected with blue and red latex. The blue is showing better in this case. And you can see these vessels that run through the medulla, and they'd be the interlobar veins. An impression of the arcuate vein is cast here, but the interlobular veins or arteries not well seen in this case. This specimen, a little better, showing the impression of the arcuate vein at least, the cortex very distinct from the medulla, pyramids, and the tip of one of those which would qualify as a renal papilla, as with this. This larger space here would certainly be a major calyx, which would continue into the renal pelvis. This specimen shows the pyramids again, an area which would qualify as the minor calyx, and then we can see that it passes into a space which would represent the major, and finally at the tip of this pointer, the renal pelvis. Looking at a frontal section of a human kidney that's been injected with latex, we can see particularly well the cortex in red, and actually there are little pinpoint ball-like structures which actually represent the glomeruli, almost all of which are in the renal cortex. Human kidneys, taken from cadavers, are not injected and are sort of monotone in color. This one is nice because it reveals the encapsule, indeed the renal capsule that surrounds the kidney, and just where it should be, this endocrine structure, named for its position on the top surface of the kidney. This is the adrenal gland, also known as the suprarenal gland. In this specimen, you can at least see the cortex and the pyramidal segments here, although not as distinct as before. A closer view shows a glimpse of a rather small pyramidal segment, but notice the tip here, which is the renal papilla, draining into what would be then a minor calyx. In this specimen, a portion of the inferior vena cava is actually attached, and this vein, which empties into it, the renal vein. This vessel, if we lift it up, is rather firm and its lumen suggests that this then would be the renal artery. Here's a reconstruction of much of the human urinary system. And at first it might seem a bit intimidating, but let's pick off the things that are rather obvious. Left kidney, right kidney. This tube, which has been disconnected from the bladder, would be, of course, the ureter, as well as this. This rather hefty vessel here, which seems to bifurcate at this level. This is the abdominal aorta, making this the common iliac artery, and these representing the external and internal iliac arteries. This artery here, branching just proximal to the bifurcation of the aorta, this would be the inferior mesenteric artery. The renal arteries, of course, supply the kidney, this being the right kidney, a bit of the renal fascia here. And if we look on the back side, even more of it is visible and quite dissectable from the surface of the kidney. It's typical to section a kidney in a frontal or coronal plane. And inside here, we can see the details that we've seen before. For instance, here are the pyramidal segments, a minor calyx, another, and yet another. And these calyces feed into a major calyx, which would then open up into this space here, which would qualify as the renal pelvis, tapering down into the rather slender and lengthy ureter. A little closer view of a somewhat damaged renal pyramid, but nicely seen here, a minor calyx, which flows away and into a major calyx. Returning to the big picture, we see again the ureters, the arteries which branch from the abdominal aorta, and this flattened and collapsed vessel here carries blood superiorly, and this must be then the inferior vena cava, which receives blood from the common iliac veins, which represent a merger of the internal and external iliac veins. This vein here, leaving the kidney, of course, and connecting with the vena cava, would be simply the renal vein. The distinction between the renal cortex and the renal medulla, quite interesting here, because the cortex is so relatively thin, and the medulla, of course, quite a bit larger in comparison. This human kidney is interesting because it's been left in place, so to speak. We can see its normal surroundings, including this perirenal fat pad. Remember, the kidneys are actually not in the abdominal cavity. They're behind it in a space known as the retroperitoneal space. This structure here, the adrenal gland, and when we open this kidney, we can see easily the cortex distinct from the medulla. There's also yellowish material here, which fills the voids in the interior, and this is simply adipose. So here we see traces of interlobar vessels, certainly a renal pyramid, and the renal fat in the interior here. Closer in, the renal cortex, renal medulla, interlobar vessels, adipose tucked into these voids, and the renal pyramids seen on both sides of this section. This kidney, a little smaller, and perhaps from a female, is interesting, of course. The renal vein collapsed here, the renal artery maintaining its shape, and quite striking in the interior, a fluid-filled sac, not uncommon, a renal cyst. Cysts can be problematic or not, and may not even be discovered unless special studies such as CTs or MRIs reveal it. Although we don't have an actual specimen of a human bladder, we can at least examine this model, which is actually the posterior aspect of a male bladder. That's known because of the prostate gland, which resides at the lower margin of the bladder, and two identical bilateral seminal vesicles. These white tubes have ascended from the testes. These are known as the ductus deferens or the vas deferens. And these tubes, which have been shown yellow to suggest their origin from the kidney, these would be the ureters. The ureters approach the bladder from behind and enter it rather low, as you can see. Looking interiorly, we see their point of entrance and the point of exit, which represents the urethra. The interior of the bladder is rather folded and resembles that of a stomach or even a gallbladder. Thus it's pleated into folds, macroscopic folds, called rugae. These disappear or flatten out when the bladder expands, and of course the bladder is capable of considerable expansion. Notice the rugae are absent in this triangular segment here, which is called the trigone. As with most organs of the human body, the average person doesn't give much thought to their kidneys unless they develop issues with the renal system. And one of the most common disorders, which is benign but nevertheless very painful, are renal calculi, also known as simply kidney stones. They typically form in the renal pelvis. So let's deposit something that in fact is a kidney stone taken from a specimen in the lab. And in this location, it does little harm unless it completely occludes the renal pelvis and prevents urine from leaving. But the real problem, of course, is when it descends into the ureter. This definitely blocks urine flow and creates a tremendous amount of pain, which doesn't subside until or unless the stone makes it to the bladder. Exiting from the bladder is often easier compared to the path from the renal pelvis to the bladder. Kidney stones can be handled in a number of ways. They can be broken up with ultrasound. They can be pulverized with lasers, or they can be extracted, if necessary, through surgery, direct opening of the renal pelvis, which requires an incision through the back of the individual. Kidney stones vary in size from the tiniest of granules to sometimes as large as a marble or even a golf ball. And these are stones taken from some of the material we've had in lab.
You were telling me last time that you had kidney stones.
Oh my gosh! Have you had one? How many? Has anybody had a kidney stone out here? Seriously, the pain is so. And this is how I knew I had it. I felt great. I'm in the tire store, getting tires for the truck. Felt great. All of a sudden, it's like Chuck Norris kicked me in the back. I made a noise. I was like, ah! Didn't say it was a masculine noise. It was a noise. So, and then it hit me again. I was like, yeah. Well, Dwayne, this kid that's ringing me up at the tire store, he looks at me and he goes, hey, I ain't no doctor. Which caught me off guard. I mean,
of course.
I had assumed that he was. He just didn't like wearing the stethoscope while he's changing tires.
At the tire store,
He goes, I ain't no doctor, but I think you got a kidney stone because my brother had one, and that's what he acted like. And it wasn't that I didn't trust Dwayne's diagnosis, but I thought, you know, Jeff, you have a little money. Why not get a second opinion, you know? So I actually go to the urologist, and he said, you don't have a kidney stone, you have 5, and one of them's huge. And when you hear stone, you think smooth river. Kidney stone looks like a ninja Death Star. I mean, it's got points and claws and hooks. And he said, when they form in the kidneys, they don't hurt, but then they pass through a tiny tube called the ureter, and they just rip through nerves and blood vessels. And so that's... I thought I knew pain. I read online, they said the pain of passing a big one was the equivalent of a woman giving birth with no meds. Any woman here done both? Nobody? So, and here's my argument on behalf of the kidney stone. I said, a year or two after giving birth, a woman will say, you know what, I'm about ready to have another child. You never hear a man say, well, I've about quit puking and crying. I think I'll drink a case of Coca-Cola, see if I can work up another.
Get one of those stones geared up.
The rigid cystoscope is introduced under vision in the urethra, prostatic urethra, and bladder. The uretroscope is tested with regard to function and integrity before introduction. The uretroscope is positioned using a straight guide wire under fluoroscopy. While performing a ureteroscopy, we see a urethral stone which appears to be impacted. The stone is disintegrated using a holmium laser. It is very important not to touch the urethral wall with the laser. The energy setting is based on the needed effect, in this case stone fragmentation, and the resulting effect of the laser energy on each specific stone and location in the urinary tract. In this case, 10 Hz and 0.6 joules are used. Using the tip of the laser fiber, the stone is moved away from the urethral wall in order to use the laser safely. The flexible urethraoscope is removed under vision to inspect the ureter and fragments of the stone. The size of the stone fragments is estimated through comparison with the guide wire, which is approximately 1 millimeter in diameter. The urinary collecting system is checked for fragments, and their size is estimated. We use a tipless nitinol basket to retrieve some fragments for stone analysis. The most standardized basket is a 1.8 French 4-wire no-tip nitinol basket. The basket is used to catch and retrieve stone fragments. This is always under endoscopic vision. We remove some fragments for stone analysis. The rest of the fragments are left for spontaneous expulsion. While retrieving the last fragment, we inspect the ureter for possible lesions.
Yeah, they're right there. Okay, good.
In this short clip, you see the rather invasive and rarely necessary open incision of the back and approaching the kidney in the retroperitoneal space. This is only needed when the kidney stone is so large and so obstructive that it demands immediate and complete removal by this straightforward but nevertheless difficult approach. Sometimes the stone grows into all of the calyces, and you'll see it in this case, something of a staghorn appearance. You might assume that this surgery would damage the kidney, but it can be sutured up, as it's being done here, and the wound closed in the normal fashion, and essentially the kidney returns to normal functioning. Let's conclude our look at the urinary system by revealing the answers to the elements seen here in Figure 63. Although the endocrine system is studied separately in lecture, you've no doubt encountered many of these organs along the way. And so here's just a overview of the endocrine organs, and we'll give you sort of snapshots of some of these endocrine glands before we conclude. Number 3 is the thymus, located in the mediastinum and properly a member of the lymphoid system. The pituitary, or hypophysis, resides in the cella of the cranial cavity and controls much of the endocrine system. The thyroid gland is inferior to the thyroid cartilage, wrapping around the trachea, and is the largest purely endocrine organ. The adrenal gland, or suprarenal gland, sits atop the kidneys and is actually composed of 2 parts, an outer cortex and a deeper medullary area. The pancreas is both endocrine and exocrine, and it secretes digestive enzymes into the duodenum, its location essentially retroperitoneal. It's most famous for its production of hormones, especially well known, insulin. The gonads are also endocrine in nature. In men, the testes, which we'll discuss later, and in women, of course, the ovaries, which reside in the pelvic cavity.